used to, um, feeling like your brain shuts down after too many activities. And by the end of the day, noting, that you're perhaps more irritable, saying things you don't mean to, struggling to attend to, a succession of things as the day goes on. So these are just some examples that may arise. And you may have some more that you've experienced yourself or those you're caring for. And additionally, not unlike last week when we talked about attention and your attention waning with mental fatigue, there's likely a feeling about the experience you're having or a feeling about the feeling. So you may experience negative thoughts or thinking, I don't like this. I'm worried about what this means for the future. Will I always feel this way? Noticing you don't feel perhaps as energetic or able to bounce back or as resilient. So those are some of the examples of these negative cognitions you may experience. You also may experience some internalized anger. So the inability to kind of manage those secondary reactions. So you may feel frustrated with yourself, or externalized anger, frustrated with those around you for not perhaps picking up on what you're experiencing or understanding it, or impatience on their end. Additionally, you can kind of have this compounded encounter with yourself or with others where you feel frustrated, and that maybe makes you anxious. And then you may become more fearful that you're anxious about your future, or you may become paranoid when you're anxious. So you can kind of have a whole host of emotions. And I don't think a lot of detail is offered, both the patient or the caregiver, on some of this kind of circular encounters with all different emotions that you might have when experiencing mental fatigue. So it's important to be patient and to give yourself a little room around the feeling about the feeling.
And a lot of people experiencing mental fatigue would always ask, like, why am I feeling this way? And, in fact, the cause of fatigue is not exactly clear, but we want to offer some hypotheses. So, for instance, after an injury, extra effort and attention are required to complete even simple activities such as like expressing verbally or walking around. So overall, there is more energy exertion, partially because of the nerves damage and the neuronal activity disruptions in the brain because of the injury. So information did not get processed as efficiently as before. Or like before, right after the injury. So to briefly reiterate what we shared last time, we like to think of a brain as a gas tank. So after the injury, our gas tank capacity, also known as cognitive reserve, reduces. And then at the same time, our demands also increases because we have to adjust to a lot of post-injury changes on so many levels. So when demands increase and reserves decrease, it can create exhaustion very easily, and one can feel overwhelmed easily too. Unfortunately, it's also very easy to ignore and not notice that the brain is tired or feeling sore. This is because the brain doesn't really have pain receptors like our muscles or other organs that can signal discomfort. So it's very important that in cog rehab, we develop this awareness of signs of fatigue and intentionally take breaks. Here are some conditions that we also pay attention to that can contribute to increasing our sense of fatigue, and we make sure that we address this in cog rehab as well. First, we look at any pre-existing or injury-related depression or anxiety. Sleep problems, especially sleep apnea, which is a condition where the brain is deprived of oxygen while sleeping, and it can actually be treated and be reversible. We look at seasonal allergies, any endocrine gland disorders like hypo or hyperthyroidism, which is reflected in TSH levels and our blood work. Any respiratory or cardiac problems that affect our oxygen exchange in the body. Other physical changes could be headaches, like pain management, any somatic pains that might be related to the injuries. There might be a lack of physical exercise as well. We look at any dietary changes that could lead to vitamin deficiencies, especially vitamin B12 and vitamin D. They're mostly associated with cognitive inefficiencies. We have blood work detecting low red blood cell count. So there's one condition called anemia that can also affect oxygen and nutrient levels in the brain. We look at chronic stress, which is often addressed in psychotherapy. And other conditions could be the medications that we take after a brain injury, including painkillers or muscle relaxers, because those can also increase one's sense of drowsiness and fatigue. So one important point to note is that mental fatigue can actually make our pre-existing cognitive difficulties even harder. So as I said earlier, the first step is always awareness, and the same applies to managing mental fatigue. When our brains are tired, sometimes it is much harder to do the following. So we have a few examples here. For instance, it might be much harder for us to hold back our feelings and actions, feeling that, impulsive feeling to act on certain things. We might have trouble initiating activities like starting a chore or starting work. It might be hard to get focused and pay attention. It might also be hard to fully understand what is being communicated to us, and likewise to explain our ideas clearly. It might be hard to remember what I wanted to do, to retain information in the head. And sometimes people also share with me that they find it harder to derive conclusions and kind of make good and wise decisions on the spot. Also, there could be difficulties monitoring one's own behavior. So everybody's experience of mental fatigue can vary. And so that brings us to the next slide. We do have our first poll activity here. We want to, again, acknowledge that everyone's subjective feeling of mental fatigue is very different. So we do want to know, what are your signs of mental fatigue? And if you are a clinician or caregiver on the call, what might be some of your clients or loved ones' signs of mental fatigue?
And I am just noticing there's something about the way that this poll was inputted by me, and I'm seeing it only allows you a chance to enter a single choice. So in this case, I think you're probably figuring out, just choose the one that you're noticing the most, and we'll change that for the future polls.
Yeah. I'm noticing that 5 out of 7 folks here have responded. So just a couple more seconds to see if the rest of the group wants to participate. All right. Okay, so I'm looking at our results here. Okay, so it does look like initiating activities and also, explaining, like verbal expression could be something that are signs that people notice that is indicating mental fatigue. So the reason why we ask this question is because it's good to notice the signs, and that is often an entry point to doing cog rehab. Like once we're able to find out or to just to identify that first sign, we can kind of work around that and promote awareness surrounding that too. So I'm going to go ahead and stop sharing the results. All right, okay. So in Cog Rehab, we always encourage our clients to practice note-taking. This helps us encode information better. And also we have a way to access the information later after the session. So at this time, if you'd like to practice the skill, we want to invite you to take out a notepad and write notes as we go over some strategies for combating mental fatigue. All right, so here we go. Strategies to prevent or reduce mental fatigue. The first one is, as Dr. Adams also mentioned, is to be intentional in taking breaks. So we want to break down tasks into smaller chunks instead of pushing through hours and hours of work. We want to insert sufficient break times. Some people may not be used to getting so many breaks, thinking that, it might be wasting my time. But remember, our brain gas tank does function a little bit different after the injury. So it's a good habit to rest our engine, pump up our fuel every now and then to kind of maintain that efficiency instead of letting it crash and go empty. So this way, our brain can kind of slowly heal and regain its neural stamina. We talked a little bit about the Pomodoro method last session, so here's some information. Okay, so the Pomodoro technique is developed by Francesco Cirillo back in the 1980s, actually. It's a time management system that encourages people to work with the time they have rather than against it. It helps people balance focus with deliberate breaks. So first, it uses a timer to break work into intervals. So it's like plan your task and see how many Pomodoros might you need. So typically, it's about like 25 minutes in length and separated by a short 5 minutes break. So here you see each interval or each tomato includes 25 minutes focused work and 5 minutes break time. So for example, for a project that takes up 2 hours, I will probably need 4 or 5 Pomodoros. It doesn't always have to be 25 minutes. I think especially in the context of brain injury recovery, it can be shorter, say like 15 minutes or even 10 minutes. And you can always choose to have longer breaks too. It doesn't have to be 5 minutes. The key here, though, is to be focused during the focused work time. So you want to protect your Pomodoro, and there is no sneaky work around break times. So no sneaky working. So what you want to do is repeat 4 Pomodoros and then take a longer break, like an hour after, before we start another cycle. So this technique has been found to be quite helpful for structuring time. And my clients do like it a lot because it helps reduce burnt out feelings, or just this feeling of feeling like overwhelmed. So let me head back to the earlier slide here. Okay, strategy number 2 is to learn to bank our energy. So, plan to do things when you're well rested. So one example is to find out if you're like a morning bird or a late night owl, and you want to do tasks at your prime time. It's also helpful to actually avoid starting a new task at the end of a very busy day, as it will make it harder for you to take breaks and go to bed later at night. So you don't want that. Strategy 3 is when you know that we're hitting the point of fatigue, or when you're feeling the fatigue, we want to make sure that we also have a habit of verifying information. It could be doing some internal check-ins, or it could be through checking information with other people and asking for repetition if needed. And lastly, as we mentioned earlier, it's always good to continue to develop an awareness of mental fatigue signals and take a rest. I do encourage, working with your therapist, thinking through the day, identifying moments when you feel fatigued and kind of working around that. We actually adopt a similar approach called pacing to manage physical discomfort for brain injuries recovery. And we'll talk more about that in the next session. Okay. So now I want to shift gears and talk about memory. So as you can see in this picture, memory is about like storing a lot of information in the brain and also taking out information accurately. So let's talk about some biology here. Where is memory located in the brain? I always have this question. So here's a very quick slide to go over the key points. So some brain regions and structures involved in memory include the frontal and subcortical structures. So in the picture, those would be the prefrontal cortex, the green section here. I'm not sure if my cursor is pointing at it, but and also the basal ganglia, which is the purple oval shaped structure here, situated in the deep area of the brain. So these areas, they work together hand in hand to register and encode information. They are also responsible for pulling out the correct information out from our memory database. So folks who experience things like, like tip of tongue phenomenon, or just finding their memories easily mixed up or jumbled can sometimes be attributed to a frontal lobe dysfunction. We also have a famous hippocampus here, very well known for memory, which is the blue region here. It is found in the medial temporal structures of the brain. And this region is responsible for consolidating information and to hold on to recently learned information. So some medical conditions such as like seizures or epilepsy can sometimes result in hippocampal lesions or sclerosis, and that can lead to memory deficiencies. Interestingly, you notice that the amygdala, this little tiny purple spot here, is responsible for processing emotions such as fear and anger, and it's actually very closely situated next to the hippocampus. So what it does, it makes it easier for us to remember some emotionally charged information or episodes better. One region that is not shown here in the picture is the olfactory bulb. It's situated somewhere close to the hippocampus too. And the olfactory bulb processes our sense of smell. And basically, it allows our smell to kind of elicit memories very easily because they're close to each other. And it also helps us pick up danger signs such as like burnt smell or like picking up foul smell, which is essential for survival. So those are some basic biology for memory structures. And now from a cognitive approach, right, we want to look at different types of memory with their functions. And so here's a good graph to illustrate this. First, we divide memory into short-term and long-term memory. So here on the left, short-term memory can include information we just learned in the previous slide. It could be a phone number that someone just repeated to you 5 seconds ago. Interestingly, like under short-term memory, we also have something called like a prospective memory, which is like a high complex form of memory involving some planning. So that could refer to our ability to remember to do something. So for example, I have to remember to take out my laundry from the washer and place it in the dryer an hour later after this webinar. Long-term memory, on the right-hand side here, can include explicit and implicit memory. So explicit memory refers to something we learn and remember consciously. And under explicit memory, we have episodic and semantic memory. So episodic memory could be events that happened to you, like how you celebrated your birthday last year, how you celebrated your graduation. Um, and semantic memory can be general knowledge of the world. So those could be like, oh, what are the names of the presidents in the US? What is the definition of cog rehab? So these are some of the things that you learn from school or from reading, or things that you hear from the news or from people. Under long-term memory, we also have something called implicit memory. So from the word, we can tell that these could be information that we learn and remember subconsciously. So for example, remembering how to brush your teeth, learning how to drive, how to turn on your blinkers to signal left, how to play a musical instrument. These are all examples of procedural memory. So I like to share this diagram with my clients and just have them identify which types of memory difficulties they struggle with and start that conversation as well. The word amnesia also comes up quite a bit in brain injury research literature in clinical cases. So I thought it's good that we bring this up in our presentation today to distinguish between anterograde versus retrograde amnesia. If you look at this timeline, when someone has difficulty recalling new information that are learned after the injury, which is the yellow area here, then we say that they may be experiencing anterograde amnesia. On the contrary, if you have difficulty recalling information that were learned before the injury, which is like before this time point here in the gray area, then we say they may be experiencing retrograde amnesia. So here you see like there's some distinction here, like lost memories. It is actually fairly common for survivors of TBI to have difficulties remembering, particularly that short period of time that led up to the injury. And so you might notice that some people would describe it as a feeling of like blanking out on what actually happened during the injury. And in general, preserved memories are usually intact, but in more severe injuries or brain injuries, sometimes we see that retrograde amnesia can also happen. This diagram is illustrated in our DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, when it comes to diagnosing the severity of TBI. So in general, we look at the duration of loss of consciousness here, the Glasgow Coma Scale, which is the level of arousal found at the site of injury, and the duration of post-traumatic amnesia. Based on the duration and the scores, we classify severity into mild, moderate, and severe levels. Post-traumatic amnesia is the time after a period of altered consciousness when the injured patient becomes conscious or awake again, but is behaving or talking in a bizarre way. For example, feeling disoriented, having difficulties like not being able to recall basic information about oneself, feeling agitated, feeling impulsive, emotional. And in some of the literature, they say the duration of PTA, the post-traumatic amnesia, can be a predictor of long-term outcome, but there are some mixed findings as well. So we also want to highlight that memory is the slowest part of the conscious mind to recover from an injury. So it does take time and a good rehab course to show its effects. All right, so next, what you're seeing on the screen here, we want to dissect our memory process and find out what went wrong in cog rehab. So the Atkinson share of memory model is a very famous cognitive model that kind of helps us tease apart how memory functions. To begin with, we have the presence of stimulus input. So our sensory memory captures it And then with enough sufficient attention, it gets registered in our short-term memory. And then in order for information to be filed away into our long-term memory cabinets here, we have to go through an encoding process. So we have to encode the information properly. And one of the things, or one of the ways to do that is to perform rehearsal. So you see the word rehearsal here. And the more you rehearse, the better the information is encoded. So practice makes perfect. After it is properly encoded and stored away in the long-term memory, we perform a process called retrieval, which is the ability to access the cabinet and pull out the correct folder to find the right information. And so again, the more this is rehearsed, the easier and more accurately we can retrieve information. So you will notice that if we don't give certain things enough attention, if they're not well rehearsed, the information will decay, and eventually they will be transported to this forgetting box down here, where we will forget the information. So this is a very general overview of how memory functions in our brain. So in cog rehab, it's really important for us to find out which part of the memory process went wrong. Our neuropsychological tests are very effective in teasing apart these processes. So we highly encourage anyone who has memory difficulties to go for a comprehensive evaluation. Learning about how the memory system works will help you ask the right questions during feedback when you communicate with your clinicians. It will help you understand how, just a little bit more about your memory difficulties. And you'll also have some test results to really inform your treatment plan. So here, there are three major ways that memory inefficiencies can be created. So let's look at the first possibility. So the first one is that the information just never got in. So what happens is that we don't give enough we don't give enough attention to the information. So it was never properly registered into the short-term memory. So what could be happening is like maybe we felt too tired, we're experiencing mental fatigue, we got distracted, or maybe our processing speed was too slow. A second possibility could be that the information faded away because there's a lack of rehearsal going on. So this happens when the information did reach the short-term memory, but it wasn't rehearsed enough, and so the details got faded away. It's like after listening to this webinar and taking notes, if we don't go back to revisit our notes or watch our YouTube link, sometimes we may actually forget the content pretty soon after. So again, practice makes perfect. The last scenario is that sometimes information got distorted. So what happens here is that the information got in, it was well rehearsed, it got into the long-term memory. However, we don't have an efficient way to retrieve the information. So it's like the folder is filed away in a cabinet, but after a while, we don't know which cabinet it's in, or it's like we don't know which key is the right one to unlock the cabinet. So as a result, we could have picked the wrong key to open a different cabinet, and we retrieved a wrong folder. And so that could be presented as like retrieving inaccurate information, or that the information could get distorted. So these are some of the main pathways or mechanism that we sometimes can identify through a very thorough assessment to really figure out what went wrong when it comes to experiencing memory inefficiencies. So having that knowledge, I want to transition to another poll activities. I want to invite you to spend some time to reflect and see which stage of the memory process you feel is contributing most to your difficulties. Right. We'll leave a couple of minutes for people to respond. Yeah, I think now might be a good time to share the results. All right, okay, so let's take a look. So I think like half of the people actually were able to identify that attention might be one of the main reasons that's contributing to memory difficulties. And fewer folks chose retrieval. I would say actually from my clinical experience, when people come into our clinic and say, oh, you know, I have difficulties with memory, it's often the case where it's more of an attentional difficulties rather than a problem with, you know, the hippocampal function of consolidating information. So I think this is also really echoing what we shared last time, is that when we talked about attention, that it is one of the basic building blocks of cognition that affects some of our higher cognitive abilities like memory, our executive functions, planning, problem solving. So yeah, thank you for responding, everybody. I think, you know, once we have an idea of which stage of the memory process that we struggle with, that is a really good kind of entry point to discuss it with your clinician and with your therapist to start the rehab work. So let's stop sharing a little bit and we'll move on to the next slide. Okay, so let's talk about strategy. So I presented this slide last time. So this is just a brief kind of recap. So in rehab, we classify strategies into two types. External strategies are targeted at modifying and optimizing environment. Internal strategies are targeted at acquiring compensatory strategies that our brain can use and adopt in certain situations. So again, note-taking time. All right, so let's take a look at these external strategies first. So everybody has a planner, or most people have a planner or calendar in their phones, but whether we use it wisely does make a difference to how we remember information. So first advice is, how often do you check your planner? We recommend checking your calendar twice a day. So maybe once in the morning when you start the day, and once before you go to bed, just before you go to bed, so you know what is happening tomorrow and you can plan ahead. Second is, when we write down appointments in our planners, we want to use the 5 W's method to add as much details to our appointment. So we can plan for our commute, we can plan for the visit. So I included these 5 W bubbles here, and I'm going to talk about them in a second. This actually bridges to doing active note-taking. So if you find yourself having difficulties, particularly with episodic memory, like remembering what people told you yesterday or last week, it is often good to use the 5 W's technique to note down things. So for example, you want to note down who was the speaker that told you that information. What did they tell you? Where did this conversation take place? Why is this important for me to remember this? Because adding significance to an event does make it easier for us to remember. And I think I missed the when. So when did they tell you that information? You can also use this technique to not only in social situations, but also to use this to keep track of news that you read, stories that you heard. just to help us keep up in social conversations. Sometimes our clients also find it hard to retain information from doctor's visit because we can be overloaded with a lot of medical information. So a good way is also actually to ask for after visit summaries or to set up like an electronic medical system account to get access to your doctor's note. So you can rehearse the information after the visit to kind of help you gain more understanding of your own care plan. We want to stay organized. So forgetting and misplacing personal belongings are frequent issues that one might encounter with memory difficulty. So we recommend putting all your essentials in a bright, colorful container or a bowl right next to your front door. So you'll always have your car keys, wallets, IDs in the same area when you come in and when you leave the house. You can also stay organized in your note taking. So just dividing your notebook in different sections, using different color tags for different topics. I like routines and chaining. This is a really wonderful technique. It's helpful if you want to learn and incorporate new habits into your regular routine. So for instance, when my doctor prescribes a new medication that has to be taken every morning, what I can do is I can chain this event to something that I already do regularly, which is to take my morning coffee right here. So I can put my medication box right next to my coffee machine. And this way, I will be more likely to remember to take the meds with the coffee. And speaking of medications, we also recommend using pill boxes that divides the meds into morning, afternoon, and evening for each day of the week. This will over time help reduce our reliance on other people to remind us to take the meds, and we can learn to be more independent. We can also make use of technology that are available to us via a smart device nowadays. One good feature is, for example, to activate the parked car feature on your smartphone. If I tend to lose my keys, I can attach something like an AirTag onto my keychain so I can use my phone to track down their location. The cool thing is it will also alert you when you leave your keys or something important behind. It kind of gives you a notification to tell you that, hey, like you are like 5 miles away from your important item. It's time to go back and retrieve it before you forget. So those are just some of the external strategies that we find to be particularly helpful and applicable. We do want to take some time to allow the group to digest the strategies. So you can check one or more strategies that sound relevant and helpful for you. Right. All right, shall we share the results? Right, so we have a small sample size here, but it does look like people do like the idea of using a planner, active note taking, staying organized. Yeah, so I think, one of the ways to kind of deepen that application is to also talk to your clinician and therapist about it and kind of think of good ways to kind of optimize these strategies and incorporate them in your daily life. So I'm going to go ahead and stop share. Okay. All right. Okay. All right, now it's another prompt for note taking. This time we're going to talk about internal strategies for memory. And then we're going to ask and invite people to keep track of these strategies because we might apply them in the coming group activities. All right, so the first one is to pay attention. And I won't go into details for this because the strategies for promoting attention can be referenced in our previous webinar. We always encourage repetition. So repeat, repeat, and repeat. So as we learned from the Atkinson model for memory, rehearsal helps to store new information. So we can do this in different ways. We can ask people to repeat information. We can review our notes periodically. We can also do it mentally, where we mentally repeat information to ourselves if we can't write it down. Chunking information. It's good to break down big pieces of information into smaller pieces. And you can apply this to small or large tasks. So one example is when you look at this picture here on the right-hand side, if I just ask you to remember the first row of letters, it might be really, really hard. But if you try to categorize them, chunk them into like different categories like animals, cat, hen, companies, or alphabets, it's actually easier to encode the information into our existing schema and retrieve them because that would make sense for us. Links and associations, what we're aiming for here is deep level processing. So we want to look for association between the new information that you're trying to remember and with the ones that you already know. So for example, if you're learning a new phone number, you might want to notice if there's any patterns, if the numbers resemble a relative's birthday, or is the number close to a holiday. So sometimes the association can act as cues and help you retrieve information. Creating stories. So sometimes putting irrelevant things into a story narrative can help us retrieve items easier and make connections. But a word of caution is like if you're someone that gets easily distracted, this might not be the best method. But I'll show you an example. So if I were to remember 3 different items on a grocery shopping list: milk, hand wash soap, and garlic. Those things are they're not related, but I can make up a story in my head. I can say something like, okay, my friend from Gilroy had lots of garlic in her fridge. And when she reaches over to grab her stuff from the fridge, she knocks over a big carton of milk. As a result, she has to use a lot of hand wash soap to clean up the area. So this is one simple example of how you can incorporate irrelevant things in a story narrative to help you retrieve information. First letter cueing. So for example, if I can't remember someone's name, I can go through the alphabet to see if that can jog my memory. So for example, I'm trying to remember a new friend's name called Darlene. So I could go like A, nope, B, nope, C, nope, D. Oh, okay, Darlene. So that could be one of the strategies too. And lastly, the PQRST. So when we're trying to remember some written materials, like reading a book or even studying for an exam, I think this is a really good strategies to use. It also taps a little bit on our ability to plan and organize. So what we want to do is to preview the information, scan the title and subsections, or you can go to the table of contents of an article, a journal, or a book. And you want to set up questions. So you want to ask yourself, okay, like, what are the 5 W's? Who, what, when, where, what? And then you want to read the materials. Number 3, read the material. And then number 4, S can stand for either summary. So you can summarize what you read in 1 to 2 sentences. Or if you're studying for an exam, you can use state. So S for state, that is to state the answers to your questions. And lastly, it's to test yourself. So when you're done with an article, you can ask, can I answer the questions that I just came up with? So with that said, we actually do have a little exercise to illustrate some of the strategies that we can use. So what I'm going to do is we're going to pretend that we're going to a party and we are meeting new friends. And your task is to remember these people's names and their favorite activities. And I'm going to invite Dr. Adams to also join in this activity with me. And we'll kind of talk through some of the strategies that we use. And I also want to invite the group, if you have some strategies that you can think of, please write them in the chat box. So we can, refer to your sharing too. Okay, so let's see. So why don't I go ahead and introduce these 4 people, and then Dr. Adams, like you can kind of also let me know how you remember them and I can share my strategies here too. So first we have in the lower left corner here, Judy Sandler. She likes to plant roses in her garden. And we have Bob Parker. He likes to spend time with his dog. Then we have Anna Judge, who likes to read newspaper every morning. And we have David Baylor, who loves to serve. Right. Okay, so now their names disappeared. And the challenge is, how many names can we remember? Okay, so I guess maybe what I can start first, and then Dr. Adams, you can chime in and tell me what strategies you have been using. So for me, I remember David Baylor, who likes to serve because his name has the word bay in it, and I think of like Half Moon Bay or like Monterey Bay or Santa Cruz, that people love to serve there. So one of the strategies that works for me is using links and association.
And I will go with Judy. And I also thought of association and links, but moreover created a story. So with Judy in her rose garden, Judy Sandler, I thought of Wizard of Oz and somewhere whimsical and in her garden. So I stuck with, at the very least, her first name through Judy.
Yeah, like using like a narrative strategy.
Right.
Yeah. I also remembered like Parker with the help of like some of the phonemic sounds. Like I know he likes a dog, so likes to bark, and he goes to a park. So I kind of use like the bark and the park to kind of help me remember his name. So those are some great, examples that, I like to do with my clients, like one-on-one, just to kind of help them be creative, to think of ways to encode and also to retrieve like information in a social setting. So I'm looking at the time. I think we can go to our next activity. All right, so for those of you who wants to check, so these are the names again. Okay, the second one I think is highly applicable as well. Dr. Adams, would you like to lead us through this exercise?
Yeah, so the idea of remembering your grocery list, we'll put up an example and then see if you can employ some of the techniques and come back to what you worked with, what you chose to use.
Okay, I'm going to show a list and we have maybe 20 seconds for folks to remember. Okay. All right, okay. So the challenge will be, how many items can you recall?
As you look at the items, noticing perhaps what you employed to remember them, what ones were easier for you, and maybe why can help you note what you were using in association or perhaps a story, or maybe what you were most looking forward to grabbing.
Mhm. Shall we try another round where we show the group a list and then we can come back to this?
Yeah.
Yeah, okay. So again, all right. Let's see if we can recall more this time. All right. Yeah, so Dr. Adams, would you like to guide us through some of the strategies that you used?
Yeah. So I was thinking chunking and categorizing, really. So kind of breaking them down to the fruits versus something that would be a main dish, like the chicken and onions. So kind of piecing those together. I also added in kind of a story about the beef and broccoli for a meal. So it was kind of a handful that worked.
Yeah,
How
yeah.
about you?
I think I also used the categories. So like in my head, I thought of, okay, like they're vegetables, they're meats, they're fruits, like you said. The other strategies that I used was the first letter queuing. So I thought, okay, A, what is A? Like A for apples. And then B, okay, well, I have beef and then I have broccoli too. So kind of like using the alphabets to like jog my memory.
Mhm.
Um, yeah.
And the rehearse that you'd mentioned earlier. So I noticed myself repeating them, knowing that if I weren't looking at it or got to the store and forgot the list, had I repeated them
Yeah.
enough, I have a higher percentage. So getting a little competitive in a healthy way with yourself.
Right, right. Yes, yes. And folks might also notice that, like, maybe in the second time round, when we show you the list again, you're able to kind of encode more words the second time round too. So rehearsal definitely helps. And it illustrates, going back to the point to our memory model, is that sometimes it's not really about the memory consolidation that's disrupted. It's more about whether we're devoting enough cognitive resource to rehearse the material. Yeah. All right. Well, we won't ask for people's scores, so don't worry. But we do want to wrap up with a poll activity just to help us, internalize some of the, or digest some of the materials. So let's, look at this poll activity. And I want to invite you to select some of the internal strategies that sound relevant and helpful for you tonight. All right. All right, yeah. So let's look at the results. It looks like we have a wide diversity of strategies that people, love. So I'm glad to see that, different strategies work differently for different people. So it's often a process. Like it's a process in cog rehab where you have to find out which works and which one doesn't work as well. So it's a process, and I do encourage you to, take this information to your sessions and discuss it with your therapist more in detail. All right. So with that said, I do want to bring us to the next slide, which is a slight preview of what we're going to talk about in our last session next week. So coming up next, we're going to talk about common physical symptoms after brain injuries. We will introduce something called a pacing strategy to kind of help us cope with these discomfort. And as Dr. Adams illustrated today and also last week, there's always some internal and secondary reactions, to what we experience on top of just cognitive inefficiencies after brain injuries. So we do want to introduce several problem-solving approaches for mood management. And also we do want to wrap up the series to talk about, some tips to prevent possible brain injuries in the future. So with that said, thank you guys for your attention. I do want to turn the time to our Q&A session now.